Vector-borne diseases represent a silent pandemic, affecting millions across the globe in alarming ways. These illnesses stem from pathogens carried by vectors, converting common insects into life-threatening agents. Mosquitoes, ticks, and fleas are notorious for spreading diseases like malaria, dengue, and Zika virus. The role of these vectors is crucial, as they facilitate the transmission of various pathogens to humans. Understanding vector biology is essential in recognizing how these creatures thrive in specific environments. Each vector type thrives under conditions influenced by climate, urbanization, and deforestation, altering disease dynamics. For example, rising temperatures are expanding the habitat of mosquitoes, increasing disease incidence previously unheard of. Globally, nearly half the population is at risk of vector-borne diseases, urging immediate public health action. Annually, these diseases account for over 1 million deaths worldwide, highlighting their severe health impact. Climate change accelerates the spread of diseases, with warmer temperatures affecting vector life cycle and habitats. Shifting rainfall patterns create standing water, which serves as ideal breeding grounds for mosquitoes. Human encroachment into natural habitats brings vectors closer to human populations, escalating risk significantly. In Brazil, dengue outbreaks strain healthcare systems, as thousands require hospitalization year after year. Socioeconomic factors compound the threat, as impoverished communities often lack access to prevention and treatment. Poor sanitation fosters breeding conditions for vectors, making outbreaks more likely in densely populated areas. For effective prevention, it is crucial to address disparities in healthcare access and living conditions. Vaccines and insecticides play vital roles in combating vector-borne diseases in high-risk regions worldwide. Community engagement fosters awareness and protective behavior, empowering individuals to combat these threats actively. Integrated public health strategies must focus on education, vector control, and enhancing healthcare infrastructure. Surveillance systems are fundamental for tracking outbreaks, enabling timely interventions that save lives. Real-time data collection through technology helps public health officials monitor disease spread efficiently. The World Health Organization emphasizes a collaborative approach, combining efforts across nations for impact. Sustainable development practices can mitigate environmental changes, reducing vulnerability to vector-borne diseases. Education campaigns inform communities about personal protective measures to lower disease transmission risk. Research into immune responses and vaccine development is crucial to combating emerging vector-borne threats. Understanding vector behavior is essential, particularly how they adapt to increasing temperatures and altered habitats. Innovative solutions, such as genetic modifications of vectors, could revolutionize our control methods in the future. Advanced technologies such as AI and remote sensing will enhance detection and monitoring capabilities significantly. A multidisciplinary approach combining ecology, health, and social sciences will identify risk factors effectively. Future research must focus on innovations that could lead to breakthroughs in vaccine and treatment development. As we combat the silent pandemic, collaboration will be vital for creating effective public health strategies. Together, we can overcome the rising threat posed by vector-borne diseases within vulnerable populations worldwide.